Hello, I'm Shelly Denes. I'm a physical therapist in the Michigan area, and I help develop the certification for fall prevention specialists. And the reason that I did that is because I think it's imperative that rehab people know all the areas involved with fall risk, besides just the obvious ones like balance and gait. And this includes many, many things. So this is the reason that I helped develop it. And as I say, I've done quite a bit of research about this over the number of years, being involved with rehab for over 25 years. Fall risk, fall prevention always comes to the forefront, no matter who you're working with. I'm passionate about this because it impacts on all of us. Even if we're young, there's a potential for us to fall. And as we get older, there's a potential for a fall or an increased fall risk. This is for our clients, for our family members, maybe our grandparents, maybe our parents, our friends. So the idea of doing a certification means that you now have credentials. It shows that you've spent time to learn about it, and then you're an expert in the field across all gamuts of rehab medicine. Okay, so the nice thing is that the certification that Evergreen has put together includes so many topics beyond just the obvious, like gait and balance. Well, they're going to, you as a professional, and anybody that is taking this certification is going to learn stuff beyond the usual, like gait and balance. We're going to talk about things that will improve the patient so that they don't have the fall risk that they had. So we need to look at unique things like medications, vision, proprioception, environment, stress, pain, ongoing diseases. And in this world, especially since COVID, we've learned a lot about immune system. We've learned a lot about autoimmunity, and many of the diseases seem to have an autoimmune component. So we've learned a lot about that. The other unique thing is that we look into research on other things besides falls. For example, cancer research, research on Lyme disease, research on cancer, research on neurological diseases like Parkinson's and MS or Guillain-Barré. So all of those impact on older adults, especially, and patients with underlying diseases like diabetes and hypertension. So these all impact on falls and increasing fall risk. So this includes common professionals, health care professionals like certified nurse assistants, licensed practical nurses, registered nurses, nurse practitioners, physicians, physician assistants, any rehab professionals like OTs, PTs, PTAs, COTAs, speech pathologists, certified athletic trainers, behavioral health professionals like social workers, psychologists, family therapists, counselors, and then other credentialed professionals, for example, case managers, professional care assistants, personal care assistants, home care providers, administrators, managers, directors of senior citizens or home or nursing homes or rehab centers, all of these. So this impacts on all these rehab people or people involved, especially with people that are elderly. After the first year renewal period, renewal is required. And the question is, why is it as important for professionals to maintain their knowledge in fall prevention? Well, things change. We learn more about some of the diseases out there. We learn new diseases. We learn new interventions. For example, autoimmune diseases. Now there's biologics that will handle a lot in terms of that. The other thing is that there's research being done. And a lot of stuff has come since long COVID. Learning about how the immune system impacts on the body, and a lot of research is being done in fall prevention. The other thing I would say is that the CDC has an initiative called STEADI, STEADI, Stop Elderly Accident, Deaths, and Injuries. The initiative is upgraded and researched on a continual basis. It has an algorithm that's available for professionals, and they also have a lot of stuff for patients. So all that stuff is upgraded and updated. Things change. And I have to say, the lecture that I do on the specialization, I'm changing it all the time because new things are learned and there's new interventions. So that's why it's important to continue to keep the certification and upgrade it. I'm very passionate about the fall prevention certification. And the main reason is I've been in rehab for over 25 years. And whether I was working with older adults, I was working with people with spinal cord injuries, if I was working with a robotics for a paralyzed person, if I was working in head injury, if I was working in orthopedics, if I was working in neurological, it all impacts falls. Fall risk is a key thing. It's a key component that we all need to be looking at. So no matter what part of rehab I've been involved with through the years, falls always came to the forefront. So I decided to start doing quite a bit of research, read a lot about it, and I really got in tune because the CDC has become so involved with this, with the STEADI initiative. And so I'm passionate about it, and I continue to learn, and I want people who have the certification to continue to learn and learn all the new stuff that's out there. It changes.